There you go. Hafa adai and good afternoon, everyone. Thank you for being here. Today we are going to do our resolution for National Cervical Cancer Awareness Month. And so we're going to read through the resolution and then invite some of our members of the community to speak on this disease and some of the challenges that they face, and also the help that they've provided to our community. So just to share the stories really is inspiring for us to all hear. Relative to recognizing the observance of National Cervical Cancer Awareness Month, on Guam during the month of January 2018, to honor those individuals who have lost their lives to cervical cancer, celebrate those who have survived the disease, and pledge to continue to combat this terrible disease through education and awareness. Be it resolved by Imenatrantai Kwachun na Legislature Guahan, whereas National Cervical Cancer Awareness Month is an annual campaign to raise awareness on cervical cancer risk factors, the importance of early detection through timely screenings, and treatment options available to women who are diagnosed with cervical cancer. And whereas cervical cancer is a type of cancer unique to women, as it is a cancer that affects the cervix, which is an integral part of the female reproductive system. Whereas cervical cancer in its later stages can lead to a cervicectomy or removal of the cervix for those women who are afflicted with this terrible disease, and the removal of the cervix may greatly impact a woman's reproductive ability to conceive children and bear offspring, which is a necessary aspect of sustaining a people's population for future generations. And in addition to reproductive ability, the removal of a woman's cervix may greatly affect her overall well-being, as many of those who have gone through a cervicectomy have expressed feelings of emptiness after the procedure. And the Pacific Regional Center Cancer Registry stated that between 2007 and 2014, Guam had a higher rate of invasive cervical cancer at 11.1%, as compared to the national rate of 7.6%. The PCCR report also shows that between 2007 and 2014, while more than a quarter of Guam women had died within 5 years of their cervical cancer diagnosis, a high percentage of women diagnosed at the early stages of the cancers had survived. Guam Cancer Facts and Figures 2008 to 2012 indicated that among all cancer types that afflicted Guam's youth, cervical cancer in adolescent females ranked the highest, but can be lowered through cervical cancer education, awareness, and prevention, such as getting vaccinated for the human papillomavirus and
I'm sure there'll be other medical terms that will be challenging. And cervical cancer is the second most common type of cancer diagnosed in Guam women, and it is the 5th leading cause of cancer deaths among Guam women. And the United States Preventative Services Task Force recommends screening for cervical cancer in women aged 21 to 29 years with cytology, pap smear, every 3 years, or for women ages 30 to 65 years who want to lengthen the screening interval. Screening with a combination of cytology and human papillomavirus, testing every 5 years if results are negative. And screening with the Papanicolo test, more commonly known as a pap smear or a pap test, is the best way to detect abnormal changes to the cervix before cancer develops, and greatly increases a woman's chance of survival with little to no long-term adverse health effects. And even though early detection may save lives, women still feel the effects of a negative stigma that follows those who may be afflicted with cervical cancer, especially since some of the high-risk factors involve having a history of HPV infection, engaging in risky sexual behavior, having a family history of cervical cancer, and smoking tobacco. And women should be able to speak with their healthcare providers about this disease to learn more about the symptoms, diagnosis, and treatment of cervical cancer without being surrounded by a negative stigma. And educating the public and spreading awareness about cervical cancer is a method of lifting the negative stigma that may sometimes be associated with the disease.
Whereas programs such as the Breast and Cervical Cancer Early Detection Program of the Department of Public Health and Social Services provide screening services to those women who may come from a low-income background or uninsured, in addition to educating the public and spreading awareness. And whereas the members of the Guam Comprehensive Cancer Control Coalition, such as the Guam Cancer Care, the American Cancer Society, the Edward M. Calvo Cancer Foundation, the Guam Breast and Cervical Cancer Early Detection Program, and the Guam Comprehensive Cancer Control Program continue to develop and offer programs and services to the community to support activities relative to cervical cancer prevention and control. Now, therefore, be it resolved that Imina 34 na Legislature in Guam does hereby, on behalf of the people of Guam, recognize the observance of National Cervical Cancer Awareness Month on Guam during the month of January 2018, to honor those individuals who have lost their lives to cervical cancer, to celebrate those who have survived the disease, and pledge to continue to combat this terrible disease through education and awareness. And be it further resolved that the Speaker certify and the Legislative Secretary attest to the adoption hereof, and that copies of the same be thereafter transmitted to Ms. Rose Greeno, RN, Chairperson of the Guam Comprehensive Cancer Control Coalition, to Mr. Venancio Emmanuel, Program Coordinator of the Guam Breast and Cervical Cancer Early Detection Program, to Ms. Marisha Artero and Ms. Tina Noket, Community Managers of the Guam Branch of the American Cancer Society, to Mr. Terry Cuabo, Executive Director of Guam Cancer Care, and to the Honorable Edward J.B. Calvo, Imagalahin, Guahan. Duly and regularly adopted on the 26th day of January 2018.
I'd like to invite all of you up front. Yes. And you can clap. And then please just, all of you, so that the public can see all the different members of our community really serving and helping those that are in need. And now I'd like to open the opportunity for those to share their story and a little bit perhaps about what you do. And introduce yourself.
Hi, thank you. Good afternoon, everyone. In behalf of the Bureau of Community Health Services, under the leadership of our Administrator, Rosalie Sabala, who is not here with us because she's continuously undergoing treatment and PI, we would like to share this, this recognition that you've given us. Special mention to Senator Nelson, Senator Munya, and Senator Terlahi, and the 34th Guam Legislature for this recognition that you've given us. This is just to show how we continue to commit ourselves or our program in the fight against cancer, especially cancer that's been among one of the top leading causes of cancer diagnosis in Guam. The fifth and the second among the second. So, in behalf of the Guam Comprehensive Cancer Control Program, which is the coalition that also we are a member of, and of course the Guam Cervical Breast and Cervical Cancer Early Detection Program, we've been here in this screening program since 2001. Actually, we've been funded. This is a national funding program. So we've been funded since 1999, but we started screening in 2001 only. So we have been into the program for 16 years. So we've done a lot of hardship, difficulties, and we met a lot of challenges in our program. And one of that is getting women into the program, really, because finding them is not that easy, even if you go out to the community. So that's one of the challenges. Although you offer free mammogram, you offer, say, free you offer, you say free, and it's there. You know, there are still women who are, you know, have negative, still have a negative impact to them, especially if you base it on their culture, social status, you know, and religious status, of course, culture. So in our program, maybe one of the challenges that we have is that we're now seeing a lot of the minorities or the Micronesian among our program. So unlike before that it's more on the Chamorros, Caucasian, you know, and other Asian community or other members of the community, but now we've seen a lot in our program, Micronesian coming from Chuk, Palau, Pohnpei, Kosrae, as far as the MRA or roadside, what is that? The other MRI, something like that. So the problem with them is that they're transient. Some of them are transient. They might stay here for like a couple of years, 1 year, months the most. So getting them into the regular screening is really hard for us. So that's why our numbers are like going up and down. So in our community or in our island as small as this, with a 160,000+ population, according to the data that we gathered or collected, it's about like 22,000 who are eligible to our program, women eligible to our program, and we only screen like 3,000. So there's a gap, or it's like only represent like 16% of the total eligible population that we can screen in our program. So this is where our challenge is, where to find all these women, how we can capture them, where to go, because we're doing a lot of outreaches. Our partners really, we've been in partners with a lot of organizations in our community, like the Guam Cancer Care, American Cancer Society, the Edward Calvo, the NCD, you know, all the stuff, and then the other non-profit organization and other organization in the community. So the thing is, we still cannot, you know, we're still not capturing all these women in our program, basically because some of them may have the transportation issue, the social issue, the religious issue, especially the Micronesian, especially the Chukis population, who women cannot do anything unless the husband will say yes to them. Or you can get your screening if I say yes. That's how it is. So that's one of the challenges. And they gave us, some of them gave us incorrect numbers. So even if we do call them, there are some instances that we cannot be able to contact them, and because of right now their numbers is working, tomorrow it will not, and that's just lost in follow-up for our program. So that's one, and there's a lot of that in our program right now, with loss to follow-up, even if they need some other procedures that they will get. So they cannot complete the screening procedure because of that reason. So that one of the burdens that we have. And one aspect also is the grant, or the grant. When we receive the grant, we have to go into this process in the government, which allow our funding or to be delayed. So there's one instances that we don't screen like in a month because we don't have yet we don't establish yet our funds, so we cannot proceed or whatever. So just like now, we are already in the half year of our program year, but we still don't have our RFP. We still don't have those. We still cannot. So we cannot still proceed with our screening. Luckily, we were allowed to do the direct payment. That's why we can proceed with our screening services, but only with our previous or current providers. But we are looking for some more providers to come in our program, So that's why we are opening right now the new RFP so that we can have more providers to come into our program. So that's one problem right now. So if you can help on that. There's some moment that payments were delayed also because of the procurement or in the, something like that. So what else? Yeah, so I think yeah, that's some of the challenges that we have right now. In our program.
Thank you. Does anyone like to share? You're the numbers lady.
I'm the numbers lady, but I don't really remember numbers. That's why I would never trust my memory, so I bring notes. But it's the people behind the numbers that matter, of course, and why we're all here and why we all want to really put a lot of effort into prevention of cervical cancer is because it is such a treatable disease. And it is sort of compared to many other cancers, and cancer does not discriminate, right? Cancer can affect anybody. With cervical cancer, we do find a lot of young women with a condition called SIN3. It's pre-cervical cancer. It's the stage where there's tissue that is not cancer yet, but it is the next stage, like roughly 80% or whatever. I'm not sure of the exact percent of SIN3s can become cervical cancer. And because it is kind of slow growing, there's a great opportunity, there's a large window of opportunity to catch, to diagnose that cancer. And there are programs, again, for people without insurance that can be tested for the cancer and treated for the cancer. So while cancer does not discriminate, we do see disparities, which means we see differences in the rates. And the most recent published study of cancer data, there was a study done, Guam Cancer Registry and Hawaii Tumor Registry together did a study comparing cancer between Guam and Hawaii for 2009 to 2013. And the cancer rates in Hawaii and the US mainland are very high compared to Guam. But the cervical cancer rate on Guam was twice as high as Hawaii's rate and twice as high as the rate in the US. Our mortality rate was also higher than the mortality rate in the US mainland and in Hawaii. And so again, and then again, when you break it down by ethnicity, we find that our Micronesian our Micronesian sisters have a much higher rate of cervical cancer than, let's say, the Filipinos have a lower rate of overall rate of cervical cancer. Chamorro women have a high rate, even compared to Hawaii, the women in Hawaii. So again, if you break it down by ethnicity, the Chuukese women have a high rate, Chamorro women have a high rate, let's see, Filipinos have a lower rate, and Caucasians have a lower rate. And it could be many different factors. It could be, access to care. It could be just attitudes toward getting your health care taken care of. And there's so many different factors that play into it. And there shouldn't be any stigma attached to it, but unfortunately, it seems like there's stigma attached to everything these days, right? And I guess because cervical cancer is in a woman's reproductive area, maybe there's some, there could be some misguided, untrue ideas about the cancer that, oh, maybe you're sexually promiscuous to get cervical cancer. No, there's no factor like that. The human papillomavirus is so common and it affects so many men and women. And it is a factor in several different cancers. So I just urge, all women to get checked with the PAP, with their doctor, annually, And that's all I guess I can say for now. Thank you.
Is anyone else? Anyone else? No? Anyone else? Okay. Lucis? Okay, sure.
I won't take too long because I know we're in between lunch. But I do want to mention that, my other hat is the chairman of the Pacific Chronic Disease Council, which is involved with many of the other U.S.-affiliated Pacific islands of Palau, American Samoa, CNMI, Marshall Islands, Guam. I just wanted to share that with our brothers and sisters in the Marshall Islands, we're looking at some of the data, like what we were talking about here earlier. And when we looked at, I'm just going to use the diabetes as an example, that's my forte, but we looked at the diabetes data and we saw that more women have diabetes. But when we look at the amputation rates, we're seeing more men with amputation. So why is that such a big difference? And so what we found out in doing the research is that many of our brother men in the Marshall Islands didn't go to see their doctor to get their glucose testing or find diagnosis at an early stage. We find out when it's too late already. They can't save the foot or the leg and they have to do an amputation. Same thing with our cervical cancer screening. I think this is like Renata and Rachel mentioned earlier. It's an opportunity that when we get our screenings at an early stage, we're able to catch if there is any indication of possible cancers. If we catch it at an early stage, we don't have to go through the big, heavy complications. So that's our take-home message, is if we can encourage our community. If you don't know too much about it, we do have our experts at the department and with many of our partners. We encourage you to come in and get screened, get detected at an early stage. We don't want you to come when it's at the late stages already and our doctors can't really do as much. So that's a learning experience, and so our take-home message is really come in and get your screenings at an early time. Thank you.
Okay, thank you very much, all of you, for coming today, and thank you for sharing your stories and some of the challenges we face. It's a big sacrifice to give your life or to help others in the community, and thank you for dedicating your work to that. And may God bless you. Thank you very much. Have a good day.